Hello and welcome back to another episode of Only a Bag, the guide to Italian travel. I'm Nathaniel Mellor.
And I'm Darcy Melton.
And today we're going to be talking about medical tourism in Italy. If Italy has medical tourism, can you be a medical tourist to Italy? But first, some very light housekeeping things. And I think at the top of the list is the fact that Darcy is still in recovery, so her voice will be in and out.
Yeah, I'm fully here, but my voice comes and goes.
So we will definitely try to keep that in mind as we record.
Mm-hmm. You're doing most of the talking today, so it's okay.
I will be doing most of the talking, yes. And for other housekeeping notes, this is an episode we have wanted to do for a couple of weeks since when Darcy was sick. I did the health travel and travel health insurance and travel insurance. There we go. Episode comparing the two, and I mentioned I would be talking about medical tourism or health tourism at a later date, but we've talked about witches, we've talked about Venice, we've talked about I think we missed a week as well. So now we are back and we are finally talking about medical or health tourism. Apparently the technical term is medical tourism, which I did not realize. I thought it was health tourism. So that's what we're going to be talking about today, and this is also kind of an announcement more than anything else that as we are going to continue this podcast throughout the year, we are going to shift slightly into, well, one, we wanted to talk about southern Italy because we really haven't talked about southern Italy yet. And Darcy is nodding. Okay, so I do have to go ahead on this.
I agree.
Just making sure I have I'm not speaking out of turn. And we're also going to be talking about various ways to live in Italy because that's something we've wanted to talk about for a while. But during the summer, when we were coming back from our break from last year, we didn't really want to talk about something as technically detailed, I would say, or technically, like you'd have to take notes, you have to remember things as living in Italy because, we would talk about visas, we would talk about the changes to expect from living in the States or living wherever you do live to living in Italy. So we wanted to just kind of give a forewarning, I guess, that that's what we're going to be talking about going forward for the next 2 months, I think 3 months, as people are cooling on their trips to Italy, I think would be safe to say.
Yeah, I think that's good.
That being said, though, we will throw in some episodes on, I think, like Christmas markets, because Italy does have some famous Christmas markets, not nearly as famous as Germany, but still some lovely Christmas markets. And we will be talking about skiing and other things you can do in the winter, especially for those of you who are planning or have already bought tickets and hotel rooms to go to the Jubilee in Rome, and you're trying to make the most of, or not the Jubilee, but the opening of the door in Rome, and you want to make the most of that trip to Italy. What else can you do during the winter? So we will talk about that in, a future episode. We're still in the States now, so as you can tell, this episode is coming out late on Wednesday because we're recording it late on Wednesday. We are still all over the place. Our schedule has not yet returned to normal, and I don't imagine it will before we get back to Italy.
Probably not.
So, I think that is everything, right?
Yeah, I think so.
Yeah? Okay.
I think let's get into the medical tourism of it all.
Perfect. And if you enjoy what you're listening to and you'd like to follow us, you can absolutely do so on this podcast. You can also follow our Instagram, Only a Bag Podcast. You can also send us an email if you'd like to, onlyabagpodcast@gmail.com with comments, questions, concerns. And we also have a website. Now that I have some time, I'm finally adding more to it. Right now, it's going to be a lot of what we've talked about in previous episodes that are going to be in article form so that you can more easily refer back to it later if you had a piece of information that you needed to remember or something that you wanted to keep in mind. So all of those will be on the website, onlyabag.com. Now, without further ado, let us talk very briefly about medical tourism. Well, not briefly. Let's spend the next 30 to 45 minutes talking about this.
Exactly.
So right off the bat, I think something to go ahead and mention is that neither of us are medical professionals.
Very good note. We are not doctors or anything like that.
So all of this is just going to be for not even advice. I think it's just so you know, if that makes sense.
Yeah, it's just sharing what we know.
And I think part of the reason I wanted to do this episode, I've been pushing for this episode only because Darcy wants to make it more sexy. And she's like, what can we do that's a sexier episode than medical tourism?
That's what I said?
No, I don't think so. But okay. In my head, that's what you said.
Okay. I don't think I've ever had that sentiment at all about the podcast.
Well, it worked for my point, I think.
Okay.
So this kind of I got the idea, I guess, because I all of a sudden got this like slew of Instagram videos all about medical tourism, health tourism, people essentially, and it like, you know, those kind of Instagram videos where you're like, oh, this is an ad, but they hired some Instagram mini-fluencer with like, you know, like 10,000 followers to, you know, take part of their program. So it's, I think one of the ones I got was for Turkey, one was for Croatia, where they don't fly you there, but from the airport, they pick you up, they bring you to the hotel, the next day they bring you to the medical place. I guess
That is wild to me. I just wanted to interject that I had never heard of this until I think you briefly mentioned it to me yesterday. I didn't know that there was I knew there was a medical tourism industry, right? And people travel other places to
For
get
sure.
medical care. I did not know you could get this sort of like all-in-one service.
Yeah.
Wild.
Which I guess, and it's one of the things where, so we're speaking to, I think, maybe 35% of our listeners here, because I looked at the statistics for this episode specifically to see how many people are under the age of 40, which is not like a great spread of our listeners in the sense that I don't know how accurate this is. This only counts followers, not necessarily all listeners. But I use this because we have a lot of friends who are under the age of 40 who either don't have health insurance or have health insurance but can't afford to use that health insurance. Like the copay is too high.
Right.
So they decide, like, I have it because I have to, but I'm not going to use it on anything. So it does seem popular to instead save up a sum of money and go to one of these countries with one of these programs and get, I mean, when I say health stuff in that sense, I do mean like tests, blood tests, kind of like a physical, kind of like, you know, gynecologist visit, kind of just all the kind
Basic upkeep.
basic upkeep. Thank you. Like what you'd go to your primary care physician for once every year, I guess, or once every 6 months. I'm not sure how often you're supposed to go to your primary, your GP. So however often you're supposed to go to them, instead people were like, oh, you could kind of save that money and go to Turkey, go to Croatia, go to some other country with a pretty comprehensive health program. In this, I found that Italy has a pretty comprehensive health program, as we've already known since we do live in Italy. However, we do live in the south of Italy, so it's not. You're going to hear a lot that, I mean, potentially just in your life, but definitely in this podcast, I'll mention that Italy has world-class health program, like a healthcare, but also like just the structure around the healthcare.
Okay.
In terms of like doctors, the equipment. So I think while it's like cheap and borderline free in some cases, it's also top of the line.
Okay.
And that is sort of like north of Rome. Like Roman north is what I mean. In the south, it is not. And there might be a few places in the south, but by and large.
The doctors are very good.
The
in our
doctors are
experience.
fantastic.
They just are underfunded.
Yeah, they're underfunded. And I think there's just a lack of, in regards to that, there's a lack of equipment. And because we've mentioned this in previous episodes, because the healthcare industry is not for profit by and large, it makes it, I mean, at least a lot of these hospitals that are public run are not for profit. It's not about putting hospitals everywhere. And as long as it makes enough money to continue to operate, you're good. It's like a lot of them do operate at a loss, but they do kind of like to figure out like, okay, each hospital has to be for X amount of people. And if all of a sudden the threshold of people falls below a certain amount in a certain distance, then they take the hospital away, which does make it difficult in where we are, kind of a dying village area. We live in a dying village surrounded by other dying villages. Mm-hmm. So once the thresholds fall, then we do lose medical care, which does kind of suck a bit. So this is actually going to be talking about the north, but also specifically like if you're coming to visit Italy and you're also thinking about, I heard I can get like really cheap healthcare while I'm there. This is kind of what that episode's about, I think is a good way to describe it off the bat. So before, I guess, getting into that part, I did want to say there is a medical visa that you can get for Italy. It seems complicated to actually get.
Why would you need a medical visa?
Great question. So when I look into this, and this is why we, again, started this episode by saying, or not this episode, but this part by saying we're not medical experts, or visa experts, I should have added. It seems like it's for people who are coming from countries that don't have access to medical procedures in that country,
okay,
but who can travel, who have the money to travel, who have the money to pay for the procedure in Italy, and who have the money to stay in Italy.
Okay.
But they don't have access to those procedures where they live.
Okay.
So that is obviously, if you're listening to this and you're American, that's almost certainly never going to be America. Because
Unless Italy has a very special way of doing one surgery, which could be the case.
Well, one of the most popular things to get going to Italy, and I don't mean as an American, I mean as anybody going to Italy for medical practices or for some sort of medical operation, is a hip or knee replacement. And these are typically people coming from like north of South Africa and south of the Sahara. So like this sort of band of countries there. They're wealthy and they don't have access to top quality sort of knee and hip replacements. This is some of South America who, instead of going to potentially Canada or United States or Asia to get it done, they go to Italy to get it done. And this is also because Italy does have a very strangely successful procedures for installing, is that the word? For grafting fake knees and shoulders and hips, that they do tend to get a lot of people even from within Europe because they have such a successful program. I don't know. I like, as soon as I read this, I was reading that they have also a really powerful sports medicine program. So a lot of athletes, not necessarily major athletes, but minor athletes will go to Italy to get, like, if they're in recovery, if they get ACL surgeries, things like that. And it's become like, oh, I wonder if there's like a crossover between we love soccer and also we put a lot of money into, sports medicine. So it was thought that was fascinating. So this was all to say there is a medical visa. You will find the medical visa. I'm not entirely sure you need it if you are only going for vacation, but also while you're there, you're like, I want to get like some blood work done, or I want to visit a gynecologist, or I want to go to the dentist, or something really minor like that. Because when I looked into it on, 45 different websites, some of them visa websites, some of them immigration offices, some of them immigration offices that deal with visas that are short-term, some of them just the government website, it's all different information, and they're all basically summed up as, for any medical procedure, you need a medical visa. But if you're on a tourist visa, you can also just get it done there, which is really confusing.
Did you find anything about if someone's coming from a country that cannot meet their medical needs, they have to come for surgery or something, but they wouldn't be able to get a regular visa into Italy, or maybe there's a waiting period, would that be where the medical visa comes in?
And I think that's a great question, and I think that is where the medical visa, because one of these websites had information about specifically which countries have an agreement with Italy, with the Schengen zone in general, to have that sort of, we don't need visas. You just need a little stamp at the border, but you don't actually need a visa to come in. So it seems like it was written confusingly, but in a way of saying, if you can't get another type of visa, like you can't get a tourism visa, you can't get a reunification of your family visa, you can't get anything else, a work visa, a student visa, then you can still get a medical visa.
Okay.
So it's a little confusing. And at the same time, I wanted to bring all that up simply because if you do read into this, I urge you to read into this if you're actually considering any sort of procedure in Italy. But again, this episode is more for people like we have friends who don't have health insurance, but do have money to come to Italy, which is a really interesting sort of slice of middle ground, I think, where you make enough money to do something fun. I mean, Italy is pretty fun, but you don't make enough money to, like, be healthy, I think. To have
that's very American, I think.
Very American. So, all that being said, there are a few different healthcare programs in Italy that you can access as a tourist, as a foreigner, as somebody visiting. We've talked about some of these in the previous episodes, and I'm going to go ahead and talk about them here just in case you're scrolling through and you saw medical tourism Italy and you haven't heard our past episodes. And the first of these medical practices that you can avail yourself of is the Guardia Turistica, which is the tourists guard, but it's not really guard, it's just like association for medical practitioners who want to help tourists. And it's government run. It tends to only be in either big cities that have a lot of tourists or small towns that have a ton of tourists and not a lot of other types of healthcare, which, I mean, is just in general, there are sometimes San Gimignano, for example, we've used this as an example a lot because it's such a popular town with tourists, but there is not like a hospital in San Gimignano. I'm not entirely sure there's a Guardia Turistica either. However, I think there's a Guardia Medica there, which we'll talk about in a second.
Okay.
So the Guardia Turistica and the Guardia Medica, which we will talk about in a second, are very similar, except the Turistica is just typically for tourists, and think of it as your general practitioner when you're abroad. It is where you go when you have a fever, when you've twisted your ankle walking around that day, when you have a bruise, or if you're at your Airbnb and you cut your thumb and it's bleeding a little bit more than a Band-Aid will take care of, or anything that's minor, essentially. Just think minor. Think, well, I guess, I don't know if you go to your general practitioner when you have minor things, but think minor for the Guardia Turistica. Like one step above what you can do at home with a first aid kit, or if you are abroad and you've been sick for a few days and you're not sure what it is, that's a great place to go. Anything that falls under that umbrella. It is typically only open at night, which can make it a little difficult, but it's because there are not a lot of places open at night to go when you have an emergency apart from the emergency room. This can best be compared to an immediate med if you're from the States, or any sort of private medical emergency services that are in a small strip mall that you go to and they give you antibiotics or steroids or an injection of something. Like, they're very basic, and they are probably going to cover 90% of your needs. The second one is the Guardia Medica. That exists in, I think, every small town in Italy, if I'm not mistaken. And they're not paid that much. I was looking into that just because some pay only $40 a day, and it's from 8 p.m. to 8 a.m.
I thought it was basically pro bono for these doctors.
Yeah, it's essentially...
they're volunteering, essentially.
And others pay €100 per patient visit.
What?
And I'm like, that is a huge spread.
Wow.
It's just funded differently by the region. So, like, some regions are just wealthier and they can pay the whoever, like, because the Guardia Medica does not necessarily need, it's one of the few types of doctors in Italy that you don't need a specialization. Okay. So it's interesting. Like, if you're a doctor and you don't have a specialization, you become a Guardia Medica. You can work emergency room backup. Like, you can be on call for an emergency room, and you can substitute for another general practitioner. And there's the only 3 things apparently you can do in Italy without specialization.
That's interesting. That's an interesting overlap too, because the Guardia Medica where we have been twice, both of the doctors who we saw there on different days had their own. Had their own specializations.
Exactly.
And they worked in other places. One doctor often worked at the emergency room in at the hospital in the town near us.
Yeah, that's right. She did.
The other doctor had his own practice and bopped around to, like, a lot of doctors, especially in southern Italy, where we are, will be at different practices on different days, or have their own practice in 3 different places where they will be on different days of the week.
A lot of driving around as a doctor in Italy.
So both of them had specializations, worked in several different doctory jobs, and they worked at the Guardia Medica like once a week, or I don't know how often they're there.
And that's the thing. So, I mean, in that sense of, you will definitely get high quality doctors at the Guardia Medica. And I mentioned that they're in every small town simply because I can't find evidence of them not being in small towns.
Okay.
They're only open at night, like the Guardia Turistica. So it's usually 8 p.m. to 8 a.m. But throughout the night, they usually sleep there. So if you have an emergency, if you have a problem, same sort of emergency though. We're not talking broken leg. We're not talking like you just stabbed yourself in an accident.
Like emergency,
Yeah.
go to the emergency room.
Exactly. We're talking, this is just feeling unwell, pains, aches, muscle pain that won't go away, things like that.
You ate something weird.
Exactly. And so those are the 2 types of medical creation.
What is the point of the Guardia Turistica?
It's to relieve basically tourist pressure, because a lot of times tourists can just go to the emergency room. But in like cities like Rome, where you have just a emergency room filled out with basically a bunch of tourists, because if you're thinking, like, if you're a tourist in Rome and you don't know where to go, you don't have a doctor.
Yes, I understand.
Your Airbnb person, I think, is just going to tell you, go to the emergency room. And on that note, so a Guardia Medica will not charge any Italians or Italian residents or anybody who lives in Italy. However, there is a small fee for non-Italian, so basically tourists, people here on a tourist visa. And I say small fee, it's usually like 40. Actually, I even have it written down because, you know what? I planned on this. And if I'm not mistaken, it's 20 for visiting them, $35 if they need to visit you.
Right, because they'll do house calls if you need them to.
And that's the second most important thing about this is both the Guardia Medica and the Guardia Turistica will do house calls. If you are at a hotel or Airbnb and you're just like, I'm feeling really bad and I don't know if I can make it there. Especially if you don't know where it is, if it's not like, which is not uncommon. Again, if you're in a small town, you might be on the coast. You might be just visiting some small town famous for one tiny thing. And you're like, oh, we'll go there to see a waterfall or something. I don't know. I don't know what people do. Then you might not be able to find the Guardia Medica easily or without a car because it might just be in town, but like not easily to get to. So you can absolutely ask them to visit you and they will charge you slightly extra. But we have found that or at least I have found through research, depending who gives you the drugs, it can be free. So if they prescribe you drugs, you have to go and buy them, obviously. But again, I think we got you antibiotics and steroids. The steroids were $2.50, the antibiotics were $5.
So that is €2.50.
Yes.
And €5.
For the antibiotics,
yes,
yeah.
Just to be clear.
Well, I don't know what they would have cost it in the States, but not without health insurance, they might have only been like $40 and but enough that it would have been like that was a day's wages. So it is quite affordable. And sometimes if it's just something simple, they will bring it with them to give to you. One story I read, somebody needed a nebulizer for the steroids. They were in Sicily. They needed a nebulizer. And so they were able to get set up with a nebulizer and the drugs. The nebulizer was free because they were returning it afterwards. So it was all really like...
okay.
Well, it's like a nebulizing machine.
Oh,
They had to plug it in the whole 9 yards and sit there for a couple minutes a day.
Dang.
And no, I mean, it made this person's trip, his trip, much easier because all of a sudden they're not sick. So those are two not quite medical tourism related, but just if you're watching this, listening to this.
There you go.
If you're ingesting this material somehow and you're basically going to Italy and you want to know if you're covered, those two things will cover you. The third, as we've talked about before, is the emergency room. It is sort of if you don't know where else to go, you can go to the emergency room. And as I've mentioned in past episodes, if they decide that it's not an emergency, they will charge you. The minimum they can charge you is €25. And when I looked into a list of different regions, it seems like the most you'll be charged is 50.
Wow.
Yeah, they don't charge very much. And when I say it's not an emergency, there also seems to be a bit of leeway on that. Like, if you go in because you think you're having heart problems or chest problems, that's an emergency.
Right.
And they will treat it as an emergency. Even if it turns out you just have indigestion, it's still you came in for an emergency. But it seems like what's not an emergency is typically just, I stubbed my toe. And they're like, that's never going to have been an emergency. But if you thought you broke your foot, for instance, and then you find out, you didn't, you just sprained it really bad, then that's covered. That's an emergency. And they'll, charge you for the ankle brace or whatever it is, but they're not going to charge you for the visit. So if you are in Italy, you are traveling around and you're, basically wondering, what can I do? You have three options: Guardia Turistica, Guardia Medica, and the emergency room, the Pronto Soccorso. But, if you're in Rome, it'll be emergency room listed there as well in English, which will be helpful. And one thing you mentioned when we were walking around the other day, because I don't think you weren't bedridden during the travel healthcare versus healthcare or versus travel insurance episode, is would I need travel health insurance coming to Italy if I'm already so covered? And I think one of the things I mentioned was essentially, depending what you're doing, you might not. I want to be very clear. If you have money, like some expendable money, definitely get travel health insurance. Just in case. Just in case. It is I think a family of 4 for a week-long trip is like $200. A solo person for a week-long trip is like $60. They are super reasonable plans, but I want to be clear, if you haven't heard that episode, they only cover emergencies. They cover dental, some of them, but you fell and chipped a tooth, not like your tooth was already chipped before you came and you made up a story to go to some emergency dental program. They're typically only for emergencies, and they don't cover any preventative care or any normal, typical, I guess, is that preventative?
Primary care?
Primary care, yeah. Know. You can't just go for a checkup. You can't use that. It's only for an emergency. But because there's already an emergency room that is free to use as a tourist, and you should be, in theory, again, depending who you are, if you have health insurance, one of the things technically when you look into coming to Italy or any Schengen zone country, one of the things is you will need health insurance. Like you need a valid health insurance card before coming. So in theory, what they do is they just get your health insurance to pay for it and then solve it like that. If there is a charge, if it's something you don't want to pay out of pocket. So all this being said is travel health insurance might be worth it for you, and it might not be in Italy specifically.
Yeah, that makes sense. I feel like if you can afford it, and you don't already have regular insurance in your home country, it's a good idea to get the travel health insurance just to be, peace of mind, just in case something happens. But if you happen to not get it, if you're currently traveling, and you're like, wow, guys, I didn't hear this episode before I went traveling, and you
What
have
were
an
you
emergency,
thinking?
you should be fine, right? You can
You
go to the
should be.
emergency room. You can.
Exactly.
They're not going to leave you on the street.
And one of the reasons I found it sounds, I think, so not catty, so cautious, so reluctant, is because a lot of people, I think, when they come to Italy, they might visit other countries like France or Germany or Switzerland, and I do not know how the healthcare systems work in those countries, so I have no idea if you're covered or not. I've heard stories about Americans going to the hospital in France and then being charged American prices, which is obscene, because even in France, even if you're not covered, I mean, you're covered, but like, even if you just look at the breakdown, it's nowhere near American prices. So there kind of seems like some people, depends where you go, depends on all sorts of things. It may be like time of day, who's working. I have no idea. So all that being said is, if you can afford health insurance, I would get it. Which brings us to medical tourism, which is, as we kind of briefly mentioned, it's just traveling for medical needs. And interestingly, I think Americans are pretty, not big on this, but I think as Americans, we have, like, it's part of our, not even mythos, but like, I know like people talk about, oh, I went down to Mexico to get my teeth done, or I went to Canada to get drugs, or not like drugs, but what are they called?
Medicine?
Pharmaceuticals?
There you go.
There we go. So I think like we do that. Like that's a thing. It's kind of a not even pop culture, but I feel like I don't know. I feel like it's like on the Friends and, in Seinfeld and stuff that would like mentioned. And it's, I think similarly in Italy, when I was reading up medical tourism in Italy, actually one of the things I kept finding is that in Italy, Italians will get on buses typically in like Turin or around Venice, like in the north typically, and take these buses to Croatia to get dental care. And that's mainly because while Italy does have fairly reasonable dental care in terms of pricing, they do not have national free or reduced or anything like that. Mm-hmm. There's no, basically it's still expensive. And in terms of like, I mean, again, I want to be clear in terms of what an Italian makes.
Right.
Like I think because if you're coming over as a student, you have to make more than the average. You have to have more than the average yearly income. And when I looked into it a few years ago, it was 9,000 euros.
Is the average yearly income.
Is the average yearly income for an Italian. So obviously there are millionaires in Italian.
Yes.
Imagine a billionaire or two. And then there are people who do not make 9,000 euros a year. Mm-hmm. So that's just to give you an idea of when you have to get like a tooth, what is it, the post put in basically. Mm-hmm. And it's 1,000 euros, which is a lot cheaper than the 8,000 they charge in the States or 7,000 they charge in the States. It is still 1/9 of what you might make an entire year and not feasible. So all that being said is there are a lot of people who do go to Croatia for dental work. And a lot of times the Croatians will speak Italian, so it makes it really easy. So coming to Italy as a medical tourist, there are typically a lot of things that people do. And even we stood in the security line leaving Italy once, and we noticed a couple of people with bandages over their nose.
Yeah, that was interesting.
It was interesting. And again, I don't think they have medical visas. I think they just go on their tourist visa. Because something that I will start this off by saying is when you go private in Italy, I think anybody can access that healthcare. I don't think there is when I look into it, there's nothing that says you need to be Italian or you need to be European or anything like that. And it also seems really common that you will go to these clinics to get a rhinoplasty or to get Botox or to get a facelift if you're going to do a plastic surgery.
Which
clinic.
is what you were just mentioning. People in mind, they didn't have nose injuries. It seems like they...
Yes, sorry, that could have been confusing.
It very much seemed like they went to get a rhinoplasty. Yeah.
Yes, which again, it makes sense. If they like, I don't know if Italy does it differently or does it well or does it cheap.
Give you an Italian nose.
Well, that's what I'm thinking, because I know that, and I think I've mentioned this on the previous episode about travel health insurance versus travel insurance that, and maybe I didn't, but in Italy, as I've recently found out, there is a different protocol for people with severe allergies. In America, we use adrenaline, we use EpiPens, epinephrine, but here they use cortisone.
Here, Italy.
In Italy.
Where we currently are not.
Right,
So
yeah.
in the U.S., they use what?
They use adrenaline or
Okay.
epinephrine.
Okay. And in Italy, they use
Cortisone.
Okay, got it.
Which is supposed to reduce the swelling in the airways and make it easier to breathe. To be very clear, I don't know how epinephrine works either, but I thought that was interesting because something that people were saying is like, if you're going to Italy, don't expect like paramedics to have EpiPens. Expect them to have some like cortisone instead
That's
for a severe
fascinating.
allergy. And it doesn't like, I don't know, it seems a little bit more outdated when I looked into it just very briefly because I was like, oh, that could be a fun episode. And I was like, there's not nearly enough information on that. It seems a little bit more outdated. It seems like what every country used to do for a while was cortisone instead of epinephrine until epinephrine became more commonly used and easily to inject yourself in the whole 9 yards. So going back to rhinoplasty, I don't know if Italy has a better procedure or like better shape. No, I don't know. Like, is there like,
I have
we
no
have
idea.
the Italian nose that you want or anything like that. I don't know if it's just a different, it seems like there's a lot of different procedures or not procedures, ways of doing the same thing. So I'm wondering if that's the reason people come to Italy. All that being said, though, is I don't think these people have medical visas and they do pay out of pocket at a private clinic. And as I mentioned just a couple of seconds ago, I do believe anyone can access a private healthcare facility. There are private hospitals, there are private clinics, there are private practices. You can pay out of pocket. And it's going to be, depending what you do, it is typically going to be 70 to 50% cheaper in Italy than in the States for the same, if not better, quality of work. There's also, as I looked up, there are a lot of laws in Italy surrounding malpractice and misdiagnosis and basically doing bad work, because a big fear is that like people come and do work and then leave and then it finds out the work is terrible. Italy does not like that as a story that's being passed around the world. Like, Italian doctors do terrible work. So there's a lot of negatives as an Italian doctor if you do try to do some quick, scrappy work and you're like, I'm never going to see this person again. They're not even from here. They're like, oh no, they will get their money back and you will lose your license. This is not like a, backstreet doctors or anything like that. This kind of practice seems to be very above board, and strictly regulated. So some of the things that people tend to do, I've already mentioned the sort of cosmetics, the Botox, the facelift, the rhinoplasties. I've also mentioned that people do come here for knee replacements and hip replacements, but I'm not entirely sure you want to do that on your vacation. Seems intense. So
Yeah, I think you'd also have to stay for some sort of recovery as well, depending. I mean, I know
exactly.
you're supposed to walk around pretty immediately after a knee surgery, but I don't know that you're supposed to be walking through airports and
Right.
things like that.
And you do have most Americans, and if you're English listening to this, I think Australian listening to this, mostly I think when I look up our breakdown of who listens to this podcast, most of our listeners will have an automatic 3-month visa. So, if you get it done day 2, you're good. And maybe not, I have no idea, but still probably don't. Just, I don't know, maybe you do some research on that. That seems intense.
Don't listen to us and then immediately book an appointment for a knee replacement in Italy.
That's like really good advice. That's really solid advice. So that's 2 of the things. Dental is another thing that people do come from. I mean, I think depending where you go, filling a cavity is anywhere between 40 and 100 euros. I know here, thank you for reminding me that we're in the States, it is 130 per side of the tooth or something like that where we go. And it's a cheap place we go. Not cheap like discount. I don't know what you call that. It's no sliding scale, but it's just of the places we live in Savannah, it happens to have some of the cheapest healthcare or dental care.
And it's very good quality.
Yeah, but I think the place where your mom goes is closer to 2 or 250 for one side of the tooth. So if you have a cavity between 2 teeth, they call that 2 sides. Or if you have one that's like between like the top and then the side that's touching the other tooth, plus the other tooth now is a cavity. So, I mean, these things go up in price. And then when we go in Italy, it's 40 euros per tooth. So it's like, even if it's like the whole, it's like, doesn't matter. It's 40 euros per tooth. So it does make it a lot cheaper. There's also, people do come here for root canals. People do come here for...
Here, Italy?
Oh my gosh, where are we? This is crazy. Thank you.
You're living in your mind.
I really am. So what happens when I have like the headphones on, I'm sitting in front of the microphone, I'm like transported to Italy. And I hope you are too, dear listeners, when I'm talking about root canals. I hope you're just picturing the beautiful plates of pasta and the terracotta tiles. So, yes, but people have root canals done. And then, as I mentioned earlier, tooth replacements, I don't know what they call, like when they put in a post. There's a specific name for that.
There is a name for that, and people listening probably know.
I know.
Can't remember.
So they do that as well. And again, that runs...
Implants.
Implants, thank you. I know that here, because I have a fake tooth.
In
Savannah.
America. Okay.
Don't worry. Here in America, when I was looking up for my tooth, because I broke my tooth when I was like 13, and I have a crown now. So that's a fun expense for my mom when I was 13. But, they're like, oh, you're going to have to think about getting that replaced soon. It's like, you're getting close to 20 years, and that's about the life of this. And it's already been chipped once and had to be repaired. So I'm not really hoping for the best out of this. And one dentist told me that we're going to have to take out the whole tooth and put an implant. And here in America, that was like $6,000 to $7,000. Mm-hmm. And on my best day, I don't have like remotely $6,000 or $7,000 lying around. And when I looked into it, I was like, oh, I can get dental coverage, but you can't really get dental coverage and then use it. Especially for something that's a pre-existing condition. It was a whole thing. So I was like, oh, that doesn't work. So in Italy, where we are not currently, it is only about $1,000. It's usually between $400 and $1,000, depending where you go to get an implant done. It also seems to depend on the amount of teeth you get done. Some of these places are like cutting you a deal. I'm like, what, on the amount of teeth you're replacing? But it makes sense because I think there's some degenerative like bone loss things where you do lose your teeth, and they're like, we're not going to charge you $30,000 to do all new teeth.
I imagine too. I think some dentist, or my aunt is actually was a dental hygienist for a very long time, and I think she said something about like when you're already in there working, it's not like you have to go to a completely new patient and set up entirely. So I can understand if there's a discount, like we're already here, we're just gonna do all the work right now. Yeah.
And I'm wondering if that's what it is, because especially too, as I mentioned, healthcare in Italy dental care in Italy is cheap, but unless it's unless you make no money, in which you can get it done for free. Or if you have, there's like special circumstances in which you can get it done for free through the state. But if you're not in those special circumstances, you are paying a pretty decent amount of money out of pocket. So that being said, though, if you're American listening to this and you're like, I do need to get a cavity filled and I have this trip coming up to Italy, you actually might be in luck, because it's really, for us, it's insanely quick and easy going to, great top of the line, like dental clinic. I don't know what they call it, dental office. And they have the
dentist?
The dentist, yeah. Well, it's like they have the whole thing. Like even here, they're taking X-rays, but there they take X-rays. They do the whole like around the head thing. They build this, they got that. They make the teeth there. It's this whole like wow. And you're charging me €40 for this. That's insane. So that's a kind of a fun little bit. There's also people go for blood work, which is again weirdly expensive in the States. I think unless you're insured. I used to work at a health food store, and this sounds terrible, I guess. Like, not terrible, it sounds super illegal, but...
It looked sketchy. It was not. But if I was just going in shopping for some food, and I didn't realize what was happening.
Yeah, it was every 2 months a guy would come. He would set up on, like, we have this, like, little cafe bar, and he has his little prices out, and he would draw blood. And he's like, and we'll run tests, and we'll get you, we'll email you with the results to be, like, measuring, like, basically vitamin levels, vitamin D levels, iron, white blood cell count, red blood cell count, things like that, just to kind of do those, because every 6 months apparently you're supposed to get blood work done.
Every 6 months?
Yeah, you're supposed to get like, I think every year you're supposed to get a full complete panel, and every 6 months you're supposed to do just basic iron levels, white blood cell count, a bunch of things, like just to make sure, because a lot of these sickness, like a lot of illnesses like cancer do show up as
right, of course,
elevated white blood cell count apparently. In like early, that's how you can catch some things early apparently. But then every year you're supposed to go in for like the full complete panel.
Yeah, I feel like once a year sounds right to me. Every 6 months is, that's good. Stay healthy.
Well, and that's a crazy thing, because again, it's like, I don't know how much it costs in the States, but I know that this guy who was doing it in a health food store, like with a little, lunch bag that he was putting the blood vials in, he was charging like, I think $220 to do vitamins and vitamin D. Like, so it was like vitamin B, whatever, calcium, magnesium, iron, and then vitamin D. And then it's like, if you wanted multiple things, if you're like, well, I also need to get like my thyroid levels tested, I also need to get I don't know, I'm trying to think of what I had tested, like inflammatory response, like immune response, you need all these things tested. This is like $1,000 I'm paying somebody.
Those seem like the really important ones,
right? And you're paying this guy who's sitting on a stool, like a ton of money in cash or card. I don't know if he takes card, maybe he takes card. It just seems wild to me. So again, I'm thinking these blood, like, but the clinic we go to in Italy, in the middle of nowhere, beautiful clinic. Like, and they have this little room, and they're very professional, and they're very, like, it's all put together. And it's, I think, if you don't have because if your prescription is a little bit cheaper, but if you don't have a prescription, it's like $90, 90 euros, and they just do a whole complete panel on you. They ask you to pee in a little cup. It's the whole kit and caboodle. So, again, speaking of things you don't need any sort of proof that you're Italian for, like, anybody can go in. I think, like, my mom was trying to convince my brother to go in when he was visiting because he needed blood work done. He's like, "I'll just wait till I get back." And she's like, "It's $90. So this whole thing about trying to save some money runs in the family. So that's one thing that people go to. We mentioned earlier the gynecologist, because that is something a lot of people do not have access to in the States. But I guess if you're traveling, you can go there. Makes kind of sense, I guess. If you're again, for checkup, for preventative care, it makes sense to go while you're on vacation, I guess. I don't know.
Yeah, I mean, especially if it's cheaper.
That's kind of what I'm thinking. There's also, people do go to get, like I mentioned, sports medicine, but also people go to get full physicals worked up. If you need to do, like, the running on the treadmill, and then, like, messaging? No. What? Measuring. There we go. Your measuring your oxygen level and things like that. If you need a full, complete panel workup, there are clinics, like specifically sport clinics, that will do that. And the what is the thing? Messaging? No, measuring.
That's subliminal messaging.
It
coming
really
through.
is subliminal messaging. Message your blood, guys. Measuring blood levels, measuring oxygen levels, things like that. So, and it makes sense because, again, there's a lot of athletes who do come through Italy, either amateur athletes like soccer players, or maybe some. We have paddle players. I think in Rome last time we were there. They had.
What's a paddle player?
Isn't it paddleball or is it pickleball?
Pickleball?
But we played with what's called. What is the one called?
Wiffle.
No. Is there one called paddleball or no?
I have no idea.
Like
the ones with the big weird foam paddle thingies
because we were
with
in
the
Rome
holes in
last
it.
year, and it was like a paddle championship.
Maybe that's what it is. I don't know.
It's wild. So they have that. So I'm like, maybe those athletes are like, I need to see how healthy I am. So that's a big thing. And again, I can't imagine a normal like, if you're listening to this, like, I'm not gonna go run on a treadmill while I'm in Italy. That seems like a ridiculous waste of time. It's one of those things I'm thinking, if you're in Rome already. And because the blood place takes like 7 minutes, and then they email you the results a couple days later. So it kind of seems like, yeah, go to the Trevi Fountain, get your blood taken.
I mean, some people are really into sports too. So, that seems like a good way to wrap your hobby and your passion into your vacation.
Yeah, that's a good point. It does. Especially because I think if one of those people, I mean, we do not do this, but if you're one of those people who go running on vacation, like you wake up early and you brought your running clothes, and you're going to run through the streets of Rome, which sounds really romantic now that I'm saying it out loud. Maybe you also want to go get a physical done. And that could be a real good option. And then lastly-ish, but not leastly-ish, people do go, like, again, there are tourists that do go for cardiology, just getting, like, I mean, some people go to get a stent put in. I'm not even talking about that. I'm talking about, like, a stress test to make sure your heart's in good condition, if, again, it's something you cannot afford in the States. So that's another thing. And last but not least is the eye doctor. Also private. I went to the eye doctor here. Where are we? We are not in Italy. I went to the eye doctor in Italy. Sorry. I'm really struggling with this. And I think they did the whole exam for, I think the guy we went to was around 100, which isn't bad, I think, because I think some of the places here are those, like, free exam if you get 2 pairs of glasses for $80.
Scams is what they are.
It kind of feels like scams, though, because I think because I was again at the place where I'm like, I need new glasses, but I think it had been years since, I was still wearing the same pair, and it had been years since I went to the eye doctor. So I'm like, I really need to know if I have a new prescription. I do not, but they gave me one anyway that was incorrect. I bought a pair of glasses.
Where? This is in Savannah.
This is in Savannah. Yeah, okay. It was like at eye lab
or something?
My eye lab, maybe.
Yes.
I had the biggest headaches for like 3 weeks, and I was like, maybe my eyes are adjusting these new prescriptions. I finally went to, like, one of your family friends who happens to run an opticians.
She's not an optometrist. She's like I don't know. It's an eyeglasses shop, and she does some light exam.
But also she can measure which I did not realize this is a thing, which is, I guess, kind of cool. She can measure the prescription of a pair of glasses.
So cool.
And she was like, "Oh no, they have your prescription almost right, but they forgot there's like a variation on the y-axis, so they just didn't put that in." And she's like, I guess that's so she basically gave me this new prescription. I could finally go and get glasses made with this new prescription. But that was this doctor in Italy also caught the same thing. And it was like, but they didn't do like one test. They did like 6 tests checking
The
for
doctor in Italy.
Yeah, the doctor in Italy. I mean, the glaucoma, checking for cataracts, checking for this, checking for that. I mean, like, there's all these different little machines that they're testing with, plus the look in the distance. Plus, they had this other one. It was like they didn't trust me when I said, like, that's clearer than that one. Because then they have this one that you, like, go and you look at a house picture, and they're just, like, it measures your eyes until the house becomes the clearest.
Whoa.
It was wild. It was like, I'm like, so what are you measuring, like, the fluid in my eyes? I have no idea. But it was like, it was automatically adjusting until the house was clear. They didn't ask any questions. And they compared that to what I was saying was like, what's clearer, the N here or the N here? So it was fascinating. And for $100, they gave me a prescription. They don't give you glasses there. You have to go to the glasses shop. And Luxottica is an Italian-owned company. It is a huge scam. Don't buy glasses from Luxottica, guys.
Which is hard because they own basically everything.
I think they own literally everything, yeah. Like Ray-Ban, Dior, Armani, Prada, like any big glasses company.
But also,
Sunglasses Hut.
yeah,
them as well.
what's the big one here? There's
In
one,
the States?
Yeah, there's one next to the Publix.
Oh yeah, they own Lens
Lens
Crafters.
Crafters, thank you.
So almost anywhere you're gonna buy glasses that's not like Zennies or iBuyDirect or Warby Parker or there's a few other like small
Or
ones.
your locally owned eyeglasses shop. However, those are sold
Almost
through
all of those
Luxottica.
are gonna be Luxottica. And actually, that's what we talked about to your optometrist friends.
Yeah.
She was like, she only orders through Luxottica, and she's like, because I have a huge head. I have a massive
He
head.
does, yeah.
I have the largest pair of glasses they sell on Zenny's website. They are too small for my head. I tried the ones on iBuyDirect. They gave me a major headache for some reason. I couldn't figure out why. My mom loves iBuyDirect. And they're a little bit more pricey, but it's like really painful headaches. So I'm not really sure why, but so I'm waiting for Zenny to come out with a larger pair of eyeglasses. If you're listening to this and you work for Zenny, just know that there is someone, if you want to make eyeglasses that are really big, and also because these are the ones I think are $5.95, $5.95 for a pair of glasses. So if you can kind of keep them in the same price range, I'd appreciate that. So,
If you need a test model, if you work for
Yes.
Zenny and you need like a real live test person, would you volunteer for that?
I would happily volunteer for
Okay.
that.
Just putting
Unlike
that out
those
into the
football
universe.
players and other famous people they're using, it'd just be me. They're like some
Well,
guy.
I don't think they test on the famous
Football,
people.
yeah, probably not actually. That'd be really
I'm
crazy.
offering you as a test subject.
Just a little monkey. One of those escaped 42 monkeys from was it South Carolina? That was a fun
End
story.
animal testing.
Yes, that was
Okay.
the intent of this entire thing.
That was
this
it. That
entire-
was the point of this episode.
And I think last but not least, I did want to mention too that this is all kind of to say, if you're going to Bologna, if you're going to Rome, or you're going to Milan, those are three of the most popular cities to go and get medical work done as a tourist. There are three very popular medical private hospitals there. I was going to say them out, I can say them out loud. It's not a secret, but I don't want it to sound like I'm promoting them. So I'm just like, if you just Google though where to get medical work done in Rome, it's
Are they private hospitals? I don't understand.
they are, yeah.
Oh, okay.
Well, you can't go public.
Right.
But they're privately owned hospitals, so you
Right.
can get anything done there.
Okay.
And the same thing too is I was going to have a list, but I didn't want to have a list because I did not want to sound like I was promoting any of these people. But if you want, as we were talking about earlier, if you want somebody to do all this work for you, Italy does have groups that will, again, you have to pay for your ticket, but you give them your arrival date, and then you show up. They pick you up from the airport, they bring you to the hotel, they bring you to the private hospital or the clinic, you get all your work done. But also a lot of them, I was checking what kind of continuity of care is there, because they also arrange tours and stuff, because it's you're not just going to come to get blood work done and leave. And then there are checkups at the 6 month and 1 year point typically to see how you're doing. Well, I mean, obviously,
when you're back in your home country?
when you're back in your home country.
Wow.
Yeah. And some of it is just to make sure that, I guess if you came for something more serious than blood work, they want to make sure that things are still going well for you. But I thought it was fascinating that there's a pretty big industry around it, and it seems like it's a bit cheaper. But again, I think
A bit cheaper than the U.S.
than
you
the
mean.
U.S.
Okay.
And honestly, I don't know, because I know that in England, I know that right now the NHS is a bit
Overworked.
overworked, I think is a good way to put it.
They are
So
taxed.
people are going private there anyway. And I know that already a lot of English people go to Spain or any other country, but Spain I know is popular for certain work. So it makes sense if you also want to come to Italy. We're here. I have for the Australians, the 8 Australians that are listening, I know actually that if you are Australian, by the way, listening to this, check and see, if you don't already know, check and see. But I've found that Australia and Italy have an agreement where Australian healthcare will work in Italy and vice
Really?
versa. I don't understand why those two countries, but when I was looking into this, it was like basically you get travel health insurance unless you're Australian, in which case you
It's
don't
like a
need
one-to-one.
it. It's like a 1-to-1. Those two countries have have a common agreement where Italians in Australia are covered and Australians in Italy are covered. So again, if you are Australian listening to this, definitely check that out to make sure it's still a thing. It hasn't like expired or something weird. But yeah, that's basically medical tourism. It wasn't so much, I think, to answer questions. I think the title of this podcast is going to be something like, can I go to Italy as a medical tourist, or can I get medical care in Italy, or medical tourism in Italy, something like that. And it's not so much to answer, you should totally come, this is the best country to do so in. It is more going to be that there is world-class healthcare in Italy. It is available to you if you want to pay for it privately. It is cheaper than you might find in the States if you're coming from the States. It is a very high level of care, not just high quality, but high level of care. And yeah, if you want to make part of your vacation doing something like getting a cavity filled or getting some blood work drawn.
And who wouldn't want to do that?
What is more romantic than that?
I mean, when I think of going to lay on the beaches of Italy,
Yes.
number 2 thought, I need a cavity filled.
Exactly. And what if I could have that done at similar times? I can go to Salerno, and then that afternoon I'm on the beach of Italy. My
Dream
mouth is
come
true.
true.
It's like, wow, why does that feel ache so much? It's becoming unnumb. Already my mouth is numb. I don't even understand. I can't even pronounce unnumb, apparently. This is ridiculous. So with all of that being said, I hope this was somewhat helpful for those of you listening who are considering coming to Italy, who are considering healthcare, who are considering, can you bundle your trip to Italy with anything else? And maybe this answered some questions for you. Maybe this gave you a ton of questions you didn't know you had. Maybe this was an episode that you listened to in the background and you thought, what was that even about? If any of those 3 things are true for you, the follow button is right there on your screen. We'd love it if you were to give us a follow. It does help us the channel. We really do appreciate it. And if you'd like to follow us on Instagram, we will use our Instagram one day. If you'd like to follow us on Instagram, we're Only a Bag Podcast on Instagram. Especially as we start filming this, we're going to film this when we get back to Italy. So we're going to start putting some little, maybe some clips or some offcuts, what are they called? Behind the scenes, those things. I don't know. The fun stuff on the Instagram, as well as maybe other videos. And we do have a email if you'd like to reach out, onlyabagpodcast@gmail.com with your comments, questions, concerns, and our website, onlyabag.com, for articles mostly.
Yes.
And some pretty pictures. To be fair, a lot of those are stock photos because we do not have pretty pictures, apparently.
Nope.
Some people out there are really good photographers, and we are not those people.
We have really good photos that you would show your grandma. And she's really proud of you.
And she'd be like, dang, you guys did that? We're like, we did. And then you see other people's photos, you're like, okay, I'm going to use theirs, though.
Yeah.
So, yeah, that's us. And that has been, we're trying out a new exit. What is it called? Outro. And that has been Only a Bag, the guide to Italian travel. I'm Nathaniel Mellor, as always.
And I'm Darcy Melton.
As sometimes.
Okay.
Goodbye.
Goodbye.